My name is Mason Johnson. This is my head to toe assessment. So I'm going to start with my uniform, everything here. Got my equipment laid out, ready to go. I'm about to enter the patient room. Hello, my name is Mason Johnson. I will be your nurse today. I'm going to go ahead and wash my hands real quick. Can I go ahead and see your ID real quick? What's your full name and date of birth?
March 3rd, 2000.
Okay. So today we're going to be performing a head to toe assessment. We're going to start at your head, assess all your body parts and functions all the way down to your toe. Do I have your consent? Okay. All right. Are there any questions or concerns for this procedure? Okay. Second, I'm gonna go ahead and close the door. Next, I'm gonna assess your appearance. You seem to be well groomed. Hair's nice. I think that's it. I'm gonna get you to stand up now. Okay. Can you put both hands above your head? Okay. Knees up. Any problems? Okay. Okay. So now we're going to be assessing cognitive function. Do you know where you are? Okay. Okay. Do you know what time of day it is? Do you know what year it is?
About 10 o'clock in 2024.
Okay. All right. So he is answering my questions, responding. I would say he is oriented ×4. So now we're going to assess recent and remote memory. Do you remember what you ate this morning? Nothing? Okay. Do you remember when you woke up this morning?
About 7:30.
Okay. Alright. So now we would ask a remote memory question. Do you remember who won the Super Bowl last year?
The Chiefs.
Okay. Alright. So now I'm going to inspect skin color, nutrition, stuff like that. So I'm just gonna check you out right here. Is it okay before you sleep? Alright. So looks good. Hair distribution. Normally we would take this hoodie off. But that's okay. I'll assess that later on in the video. So looks like his legs are good. You don't have any scars, no skin issues that's been bothering you. Okay. All right. Quality's good. Distribution hair is even. Nutritional status. So, is your diet been okay? Have you been having any problems nutritionally? How does your diet look?
I try to get, some dairy, some veggies, some fruit, some protein in there.
Okay. You look like a healthy guy. You seem pretty fit, but just to provide education, I would let him know about fiber in his diet. Make sure he gets enough fiber, gets enough fluids, 8 cups of water a day. Okay, so now I would assess your behavior. Have you been experiencing mood changes, anything like that? Okay. Alright, now your thought process. Can you tell me the similarities of a lake and an ocean? What do they have in common?
They both have water.
Okay. What about sports, baseball, football, and soccer? Okay. Alright. Okay, now I'm going to assess your skull symmetry. These gloves. Face symmetry. Just make sure there's no masses, point on your head, or no soreness or anything like that. Okay? You okay with me touching your head? Okay, seems to be symmetrical. No soreness, right?
No soreness.
Okay.
No missing or broke teeth that I can see.
Alright. And then, now I'm going to assess your judgment if I can get these bugs off. You know the importance of this physical, this head to toe assessment? Okay. Alright. Just to ask another question, just to make sure your judgment is on, you know the importance of going to school whenever you're younger?
Get my
Okay. Alright. Okay, so now we are doing the Snellen chart with my patient. So here's the chart. I would make sure I count off 20 feet into where I will be testing the patient. So to begin with, I'm going to give you this card. Will you cover your left eye and read the furthest line that you can?
Alright, I'm gonna do line 9.
Okay.
L-E-F-O-D-P-C-T.
Okay. Alright, and other eye?
I'm gonna do line 9 again.
Okay.
L-E.
Can you read line 9 backwards this time?
Line 9 backwards. T-C-P-D-O-F-E-L.
Okay. Alright, now both eyes, read as far as you can.
I'm gonna do line 9 again. L-E-P-O-D. I messed up. L-E-F-O-D-P-C-T.
Okay. Alright, and it is important that if they read the same line, make sure you get them to do a variation like backwards or something just so they're not memorizing the letters. But that's the Snellen chart. Okay, so as of now, I'm going to be assessing the patient's nails. I'm going to be assessing the curvature, the color, and we'll go ahead and do the capillary refill. We may do that later as well. Have your fingernails, you've been having any problems with these? Okay. Color looks okay. No problems though. Okay. Patient reports no problems, so we'll move on. We'll go to. So now I'm going to touch your head, assess the symmetry, stuff like that. Are you okay with that? Okay. I'm going to palpate for any mass. Anything sore? Anything like that? No? Okay. Okay. Alright, so that's not sore.
No soreness.
Patient reports no soreness, no mass is reported. So now we're going to be going to cranial nerve 7. We did this earlier, but we're going to touch bases on it again. So this is your facial muscles. Can you make a frowny face for me? Okay. Can you make a smiley face? Can you lift eyebrows? Can you do one side at a time? Can you wink? Okay. Blink. Okay. Alright. So cranial nerve 7 was good. Now we'll move on to cranial nerve 5. So now I'm going to assess your facial motors. I'm going to place my hands on your jaw. Will you open and close your jaw? Okay. Alright. Turn your head. Okay. You open. You're going to feel for your artery down through here. Here. Okay. Can you close your mouth? Clench. Okay. Alright. Can you, I'm sorry, I completely forgot this. Can you puff your cheeks? Okay. Alright. Okay. Now, okay, I'm going to ask you to close your eyes. Let me know whenever I touch your face. Okay? Okay. 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 Alright. Okay, so cranial nerve 5 was assessed, and the puffing of the cheeks, that was for cranial nerve 7 that I forgot to do. Now I'm going to palpate his sinuses. Have you been noticing any sorenesses within your face? No? Okay. Alright. Let's start up here. That's not sore.
No, no soreness.
Okay. What about through here?
No, no soreness at all.
Okay. So patient reported no soreness. Now I'm gonna assess his visual field. Will you sit up for me? Okay.
Is it your?
Oh, you're good. No, you can just sit right there. Okay. Okay. Will you cover one eye for me? Okay. So I'm going to ask you to tell me when you see this finger. Just say now. Okay?
No.
Okay.
No.
Okay. Switch eyes. Okay. Okay. Alright. Same. Okay. Alright. Other eye. Okay. Alright, I'm gonna get you to focus on my finger. Don't take your eyes off. Alright. Now, I will be inspecting my patient's eyes. Alright. If you would just stay straight, I'm gonna pull on your eye a little bit and look. I don't know why I got my pen on it right now. Okay. Okay.
You okay?
Yeah.
I think you did that. You said push, pull.
Okay.
Yeah.
Have you noticed any irritation?
No
Nothing
irritation.
bothering you? Okay, patient's eyes, no discharge, no redness, no abnormal movements of his eyes, doesn't report any irritation neither. Now I'm gonna be looking at cranial nerve 3, oculomotor. If you will, just stay looking straight. I'm gonna assess your pupils, your reaction to light.
Where'd they go for lunch?
Okay. Okay. Alright, pupils react bilaterally. They're both the same. Move with light the same. They went from around 4 millimeters in diameter to 2 millimeters in diameter. Okay. Alright, so now I'm going to assess my patient's ears. Okay, I'm going to make sure to push the hair back, especially if my patient was a girl. I would make sure we're testing for elasticity, symmetry, color. You notice any problems with your ears? They give you any,
I'll be doing this with the veil and with the diamond.
no rash, no tenderness? This is good.
Good, all good.
Okay, alright, so I inspected, his ears for color symmetry. Now we're gonna inspect, well, looking for my pen light. Now we're gonna inspect the ear canal. Okay. If you could you just tilt your head just a little? I'm gonna pull this. Okay. We're looking for how much earwax in the ear. Have you had any problems with your ear canal? No swimmer's ear, nothing like that. Okay. Color was good. Drainage was minimal. Okay. Now we're doing cranial nerve 8, which is acoustic. That would be pertaining to your ear canal. I'm gonna cover this ear. I'm gonna say a series of words. You just repeat them back. Okay. Actually,
This is lower.
okay.
Stethoscope.
Y'all, and then y'all can do the rest of it. And then when I get back, we'll knock out.
So he missed one, so we would make sure. Sorry.
I'm leaving right at 2:30.
I'll pay.
Yes. Okay, so both acoustic cranial nerves are I guess that's one cranial nerve, but both ears were passed the test. Now I'm going to inspect his nose for size, color, shape, symmetry. Have you noticed any problems with your nose? Okay, can you look up for me? Okay, seems to be symmetrical. I don't see any drainage.
And since my patient has,
Okay, you can flare your
since my patient
nostrils.
has nail polish,
Okay.
it says the fingers, and since I did
So
that, you know, there's
no problems with the nose there. No abnormal findings. You can flare your nostrils. Okay. So now to go more in depth, can you lean your head back? Okay. I'm just gonna take a look. Okay. Alright. I don't see any drainage at all, so he passed, no redness, no lesions. You don't have a cut in there, do you? That you can feel. I didn't see any. Okay. Now we're gonna do the olfactory cranial nerve. So I'm going to, if you will you just close your eyes? I'm gonna find something for you to smell. Okay. Normally you would use something on hand such as an alcohol wipe, which we do not have within our reach. Take a big sniff. Okay. Can you tell me kind of what that smelled like?
Like a fruity.
Yep. That was fruit punch from Sonic. So you passed. Okay, so now we will inspect the mouth. Okay. Just close your mouth. Okay. Lip symmetry seems to be symmetrical. Okay. Will you open your mouth? Okay. I'm gonna go ahead and use my pen light.
forming, swelling.
Okay. Everything seems to be intact. Color's good. No lesions. Any irritation with your mouth? No drainage. Nothing like that. Okay. Okay. So now we will be assessing inside the mouth and the tongue. Will you open up for me? Stick your tongue out. Okay. Does seem to be moist, pink. Any problems? Any dryness? You ever get dry mouth at random times? Okay. No reported dryness, irritation. Now I'm going to assess cranial nerve 12. Can you move your tongue side to side for me? Up and down. Okay. All right. So he does pass cranial nerve 12 examination. Now I'm going to look at your buccal membrane. Okay. I'm just going to look at your gums, teeth.
Temperature,
Okay.
moisture.
Seem to pass. Okay. Any irritation with your gums? They look pink. Same consistency as the rest of the mouth membrane. Also, I looked at your teeth right there. They seem to be good. Are you brushing at least once a day? Preferably twice a day. Go to the dentist. Normal checkup about once or twice a year. Okay. So now we're going to be assessing the oropharynx. Will you go ahead and open your mouth for me? Alright, can you say ah? Okay, uvula noted. Membrane seems to be pink, moisturized. I didn't see any lesions or tonsils. You did get your tonsils. Okay? Alright, so now we're going to assess cranial nerve 9 and 10.
Her lower extremities to see if I see any
Can you say ah? Okay?
plasticity or no tremors or no.
Okay.
Okay.
Gag reflex assessed. So that was cranial nerve 9 and 10. Now we're going to be moving to the neck. Can you look this way? Can you look this way? Can you hand to the side? Okay. So movement both sides. Symmetry of the neck seems to be on par. Okay. Now we're going to go to neck palpation. I'm gonna palpate your lymph nodes. Is there any soreness? No soreness. Okay. I'm gonna
Both were there. Now we're
fill
going
up
to
your
do the posterior
throat.
tibial.
Okay.
I said something about paying.
Can you swallow for me?
Look, starting at the feet.
Sorry, I know you just swallowed.
You're good.
Okay. Alright, so palpation is complete. No irregularities. Lymph nodes felt fine, no soreness there. Okay, now we're gonna go to the carotid pulses. Alright, make sure that you do not palpate them at the same
Start
time.
with the dorsal medius.
Okay,
Just toward the big toe.
Okay.
Okay, next we'll do the posterior tibial.
no soreness.
Back of the ankle.
No soreness noted. Carotid pulses.
Okay, next we'll do moving on.
Palpate. Now I'm going to listen to the carotid pulses. Okay?
Okay, next we'll do moving to the femoral.
Just don't have much water in it, that's why I feel.
Okay, and those were all powerful. Next is the skin. I'll talk about her skin. Her skin's warm and dry. Alright, so I was assessing her, I was looking at her skin was warm and dry. I'm seeing no edema. Turgor. Turgor's less than 6 seconds. Next we're going to be doing some range of motion activities. So I'm going to have you do, flex your foot. Does that hurt? Try it this way. Okay, can you roll over on your side, please?
You are good. No irregular sounds were heard.
Okay, as we saw right there,
There were
has no problems with her range of
the
motion.
carotid pulses were auscultated. Now we're going to move to where you'll be standing. So if you would stand for me, please. I'll go this way for the camera. So I'm going to assess spine symmetry.
I'll start palpate skin.
So what I'm going to ask you to do is to flex your shoulders for me.
My patient, her skin is warm and dry. I see no edema.
No, just like that. Yep. Okay. Now can you do one side?
Next we're going to move on to
Okay.
some
Can you do the other side?
So I'm going to have you do.
Okay. So cranial nerve 11. He passed cranial nerve 11 inspection. Now I'm going to inspect the posterior chest.
Flex your toes.
Okay.
Can you roll over on your hip?
Everything seems to be symmetrical.
Push on my hand.
Any soreness
So by that judgment,
anywhere?
my
Any
patient has no trouble
problems?
with her muscle
Okay.
strength and range of motion in her lower extremities.
Now I'm going to palpate the posterior chest. Make sure it is symmetrical.
You got like
Okay.
I'm flexible. You're good.
Any soreness of the bones anywhere? No.
literally right there.
Yeah.
No, I'm literally gonna wear this.
Okay.
One.
Now I'm going to feel whenever he breathes in and out. Can you take a big deep breath for me?
Muscle weakness,
And out.
edema,
Okay.
and there's no
Do it
swelling,
again.
like it's tender.
Okay. Seems to be symmetrical expansion. One more time for me.
You don't see any lesions, but he did tell me he had psoriasis.
Alright.
Knows that already. And then we're gonna palpate.
Alright. Now I'm going to be auscultating the posterior chest for lung sounds.
test would be the patient swimming and not being able to sit down.
Is that okay if I auscultate
She has
for your lung sounds? Okay. I'm gonna make sure this is clean. I'm gonna warm it up first.
Take a step forward, and we're gonna ask, spin around and face this way. Good job. Then you go ahead and touch your toes for me. I'm just gonna check spine symmetry and make sure that her shoulders and everything's even good. You sit up.
Can you take a deep breath
Everything
for me?
looks good there. Her spine was
One second.
even. Her sides were symmetrical. Next,
There
we're
we
just gonna
go.
test hip flexibility and spine flexibility. By asking the patient to keep her feet still and just turn and look back towards me.
Okay, now I'm gonna check in my patient.
So she has good range of motion in her spine, and that concludes all of the assessment skills for this head to toe.
And it's palpable on her right.
Oh, finally.
So on her left foot, I'm gonna check
Okay.
the
We know that you-
That's palpable. Palpable on that foot, so now I'm gonna check the popliteal pole.
You don't have to sit down.
And go sit that way. I'm gonna check the femoral artery. Pulse.
No, we're ready to. I really don't know why.
It's not broke, it's not a crash.
Now I'm gonna be checking the skin. It is going to be dry throughout
Alright, I'm
the
gonna
body.
use
I'm
this right here.
gonna check the skin turgor. It is 1 second. There is no edema throughout the body. Now I'm gonna be testing her range of motion and ability strength in the
Last
ankle. So can you push down my feet?
Last
Stay in
call.
the
Okay,
back.
this is Jesse Campbell, and this is
Okay,
my
and then I'm gonna get you to
I have
raise your
set
leg
my
up,
supplies
raise
to
your
the
leg
side, and
yourself.
make sure privacy.
Okay.
Last
So
one.
yourself.
Hey, I'm Josephine. I'm gonna give you a range of motion.
Your legs are good.
Water. Sorry.
Now I'm gonna
How are you?
okay, and raise your legs up and fold your ankles.
No cackles or crackles. No abnormal sounds found present in all regions. Okay, and now I'm going to percuss for CVA. Are you okay if I percuss your back? Any soreness? Okay. Okay. Any soreness? Okay. No soreness reported. Now I'm going to inspect, if you will. Will you have a seat for me? Okay. Now I'm going to inspect the anterior chest. Okay. Just gonna look for symmetry. Midline. Both of them look very symmetrical. Okay. So symmetry of the anterior chest was assessed. Can you give me a push with both arms? Just like you're pushing a ball. Okay? Movement of chest looks symmetrical, equal on both sides. Okay, now I'm going to auscultate the anterior chest for lung sounds. Is that okay with you? Okay, so I'm going to warm the stethoscope to make sure it's not cold on the patient's body.
Josephine Campbell, 11/29/2003.
She has full central position and they're in here. Okay, she's oriented there. Good. Now we can just move on to gait now.
Yes.
Okay.
Yes.
Okay, so now I'm gonna take my patient to
Joe Biden.
George
Washington.
Okay.
Okay, patient's remote and his ears are both intact. Do you ever feel like you're being collared?
Yes.
Those are
Patient
fine.
had AIDS.
Now we're going to do
Now we're going to do public
Now we're
speech.
just-
Excuse me,
Bacon, eggs,
and some strawberries.
You put your hands on my chest. Okay, patient has good nutritional habits.
Okay.
So the patient is not swayed, so that is the sign of a negative convert. She speaks good. So that's a sign of a negative convert. Looking at her right off the bat, her skin looks that color, she's clean. Her hair looks clean, she's clothed. She stays
So
healthy
those are also
hygiene.
palpable on both sides, and I would rank all of those. Plus 2 on the scale.
And then looking at her stool and
So
her
it's not
face.
faint, and it's not blood throughout the entire body.
Then
Turn the board a little bit from the court.
body size.
I have some balls.
And then which shows like
Okay.
your gait, like there's no imbalance in color, like I
Moisture
said
out,
earlier,
skin
hair around, distributed, limping, there's no
Alright,
smooth.
no abnormal sounds were reported. It sounds clear. Okay, now I'm going to well, actually, I'm just going to inspect first. Yeah, you can keep this on. Inspect your upper extremities. Okay, I'm going to do this on both sides. Oh, I didn't mean to hit you. Okay, and turn. Okay. Have your upper extremities been causing you any problems, any soreness, rash, weirdness, nothing out of normal? Okay. So anterior, not anterior, upper extremities, all seem to be okay. Now I'm gonna check your capillary refill. Okay. I'm gonna start here. Okay. Pretty sure we done this earlier, but never hurts to do it again, just to be sure. And this checks circulation. Okay. Color of upper extremities seem good. Temperature is moderately warm. Cap refill is under 3 seconds. Alright. No tremors. All good there. Now I'm going to assess your joints. Can you hold them out? Can you turn it? Okay. You bend the elbows. Okay. Shrug your shoulders above the head. Okay. Alright. Joints were inspected. No swelling that I've seen. Okay. Alright, now I'm going to palpate your muscles, okay? I'm just going to feel for any lumps, masses, or anything. You tell me if you're sore or it's uncomfortable. Okay?
And then just start over on that and start over.
Okay. No masses. Was any of that sore?
No.
Okay. No masses reported. No soreness, no swelling. Okay. Can you hold your arms out to me? Okay. I'm just checking you for tremors. Make sure you're not flaccid in your arms. Flaccidity. Okay. And none of that was tender, correct? Okay. No tenderness reported. No tremors. Okay. So now I'm going to be assessing my patient's grip strength. Okay. Can you grip my fingers? Okay. Equal on both sides. Have you had any problem? Weakness gripping? Nothing like that. Okay. Can you raise both arms straight? Okay. All right. Any trouble? Any that hurt? No inflammation? Nothing like that. Okay. Fingers. Any problems? Any irritation? Okay. Okay. I'll do that. Okay. Alright. Okay, now I'm going to, actually, let me see the range of motion from your shoulders. Just do that, do a full circle. Okay. Alright, range of motion for shoulders, wrists, fingers, all that was just assessed, no problems there. Grip strength was equal on both sides. Okay, now to palpate your brachial and radial. Okay, you will just sit still for me. Okay, present. Okay. 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 Alright, brachial and radial pulses both present, no irregularities. Now I'm going to assess, or I'm actually going to get you to lay back in the bed. I already have the bed at a 45-degree angle, so if you will, just lay your head back. Okay. Can you look that way for me? Okay, and look towards me. Okay, just looking for the jugular vein there. Okay, so now I will be auscultating my patient's upper area for heart sounds. I'll be listening for the S1 and the S2 sounds. Okay, are you okay if I auscultate for your heart sounds? Okay. 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 And now I would flip to the bell. Listen for the same exact thing in the same exact place. Okay. Okay. Head and lay you flat. And whenever I get you flat, will you bring your knee? Yep. You know what I meant. Knees up. Okay. Now what I'm going to do is I'm just going to inspect the abdomen. Where's my stethoscope? I've already got it. So after getting the patient in place, you want to make sure the head is completely flat. Now I'm going to inspect the abdomen. Okay, seem to be symmetrical. Have a little bit of hair here. Everything looks good though. Have you had any problems with your stomach in general? No. Okay. No problems reported. Now I'm going to auscultate. Okay.
Just let me know.
Okay. Alright. So, auscultating, normal, active, present in all 4 quadrants, and when doing this, you would need to start right lower, right upper, left lower, and now I'm going to lightly palpate, okay? You let me know if it's tender, if I'm hurting you, anything like that, okay? Or even if you feel uncomfortable. Okay? Does this feel okay? Okay. Alright, now that I'm done lightly palpating, I'm going to go into more pressured palpating, okay? Let me know if I'm hurting, okay? Okay, so now I will be inspecting my patient's lower extremities. Is that okay with you? Okay, I'll be inspecting for the color. I'm gonna go ahead and do his capillary refill. Color seems to be okay. Any soreness, any problems going on down here? Okay, so capillary refill was under 3 seconds. Perfusion seems to be doing pretty good. No poor perfusion. Alright, now I'm going to inspect. Do you have any muscle weakness? No? Okay. I'm going to palpate just to make sure. You let me know if I'm hurting you or if there's any soreness. Okay. All good. So there was no soreness reported throughout the legs while I forgot the word. Palpating. I'm sorry. Lower extremities inspection. So I'm gonna look at your bones. I'm gonna see you seem to be symmetrical. One foot's not longer than the other, but really we would get you to stand up to be able to see that. But I mean, you seem symmetrical. One kneecap's not higher than the other, nothing crazy like that. No deformities, no swelling, no tenderness throughout the, okay? No tenderness reported. I'm gonna check again for lesions, okay? No cuts or scrapes on your legs or feet, right? Okay, all right. So no lesions were found. Alright, now I'm gonna test for soreness of joints in here. I'm gonna go ahead and bend these. Nothing, no irritation. Okay, take your feet, toes. Okay, now you let me know if this hurts. Good. Okay. Alright, we're gonna do the same on this leg. Okay.
All good.
Okay, alright, now I'm going to go ahead and check the pulses down here. So we'll start here. Okay, then we'll go back here. Okay, then we'll go back here. Here, actually. Normally you would go under the clothes, so I'll go right here on this one. Okay. Then right here. Okay. Alright. Okay, so I will be testing my patient's skin turgor. You would test in the chest because that is what the most recent study suggests. Okay, so we're good. And to test in the feet, I'm just gonna test it on the shin. Okay. Okay. Alright. Palpation of the skin, moisture feels good. Color is not abnormal for the patient, so everything checks out okay. Now I'm going to assess your range of motion for your lower extremities. So can you do a hip thrust for me? Okay, test it for the hip. Will you keep it straight? Okay, will you bend your knee? Okay, all right. And do it for this side, same thing. Okay. All right, now will you flex your foot like you're pressing the gas pedal? Okay. Okay. All right. Patient equal on both sides. I'm actually gonna do one more. I almost forgot about. Okay, can you press down for me? Your whole foot. Okay. All right. One more. Okay. All right. Seems to be equal strength. I would give him full strength on both sides. So that is range of motion. Now I'm gonna get you to sit on the side of the bed with your feet hanging off. Okay, so now I'm going to test some of your reflexes. Can you take this hand and put it to your nose? Okay, other hand. Okay, now can you rub your right heel down your left shin and switch? Okay. Okay, so I'm gonna go ahead and start by testing your reflexes, okay? Just relax your fingers, keep them completely relaxed, okay? Okay. All right, just relax your arm, keep it completely relaxed. Okay, now I'm gonna go to this arm. Just completely relax them. Okay. Okay, now I'm gonna go down to your knee. Just completely relax your knee, okay? Okay. All right, now I'm gonna move back to your Achilles. Okay. Just completely relax your leg. Okay. Okay. All right. So, tested all the reflexes. I did forget the tricep reflex though. That was a close one. Okay. Just completely relax your arm. Okay. All of his reflexes seem to be good. Now I'm gonna get you to, actually instead of laying back, I'm just gonna get your foot to go up. Now what I'm looking for is your toes to fan out whenever I do that. Normally we would have a tool to test this, but we do not have it. Okay, that'll work. All right. Okay, toes did fan. Now I'm going to do a sensory test, sensory perception. So I'm gonna do these in various places of the body. Just need you to close your eyes and tell me sharp or dull.
Dull. Sharp.
Okay.
Dull.
Okay.
Sharp.
Okay.
Dull.
Okay.
Sharp.
Okay. You have passed the sensory test. Now I'm going to get you to stand up. Okay. Now I'm going to test your gait to balance. Need you to walk heel to toe to the door or the pole. Okay. Come back. Now I'm going to get you to do the Romberg test. So you will close your eyes, put your arms out, and just balance. Okay, he passes the Romberg's test. Now I'm going to check your spine and your range of motion. So I'm going to get you to turn around. Okay, feel your spine. Seems to be symmetrical. Even though we checked this earlier, I'm going to get you to bend straight down, touch your toes. Okay, see it go straight down. Good. All right, come back up and go to the side and to the side as far as you can. Okay. All right.